What to expect when accessing speech-language pathology services. The field of speech, language, and communication sciences includes the understanding, assessment, and treatment of communication challenges involving speech, language, conversation skills, and the movements required for speaking and swallowing. Speech-language pathologists, or SLPs, have unique training in physiology, that is the muscles and structures of the human body, neurology, which is the nervous system, and child development for speech sounds, language skills, and the social use of language. Some SLPs also have training in the mechanisms required for safe eating and drinking, in AAC services, and with specific neurodiverse conditions such as autism, acquired brain injuries, learning disabilities, and other genetic disorders. SLP services for autistic individuals can help with improving speech clarity, increasing functional vocabulary, increasing communication skills, such as to have their wants and needs met, to be able to make comments, and to answer and ask questions, having conversations and being social, reading and writing, being comfortable with the use of gestures, facial expressions, and other nonverbal communication, and improve eating skills involving chewing, swallowing, and expanding the types of foods eaten. An SLP is a regulated health professional and must be registered with the College of Audiologists and Speech-Language Pathologists of Ontario. SLPs are required to directly oversee and supervise all speech and language services provided by a speech-language assistant or communicative disorders assistant. Where do SLPs work? SLPs work in a variety of settings such as clinical settings like hospitals and treatment centers, in educational settings such as schools, and in community settings like long-term care facilities and private practices. SLPs often work together with many other service providers to help individuals meet their goals. How do speech and language pathology services work? First, an assessment is completed to determine an individual's starting point. Next, the SLP works collaboratively with the individual and their family to set meaningful goals. Then an intervention plan is developed and services are started. During services, there is an ongoing process of data review, evaluation, and reassessment to determine if the goals and plan are working or if they need to be adjusted. What do SLP assessments look like? SLPs use a variety of assessment methods such as play-based sessions, standardized and non-standardized assessment tools, checklists, direct observation, caregiver reporting, or a combination of these activities to determine the skills required for optimal learning and communication. What do SLP services look like? Services and therapy can look different from one session to the next, and the SLP will often use one or more methods within a session, such as repeated or intensive practice of specific targets or goals, play-based naturalistic practice where preferred toys and activities are used to work on the goals, generalization training, which means providing homework to practice new skills in other environments, with other people, and with a variety of materials. They may also conduct parent or caregiver coaching within the session to assist their child's learning, or separately to work directly with the parents. SLPs can also provide consultation to those in other settings, such as schools, community programs, or work settings, and they may also make referrals to other services or providers that may be appropriate to meet the desired goals. How do we know if speech and language therapy works? SLPs work through an evidence-based practice approach, which involves the collection and analysis of data to show if the services are working. Progress is reviewed, and if needed, modifications are made. During services, meetings occur to discuss next steps such as discharge, transition to other services, or setting new goals. Where can I find an SLP? Autism Ontario has a list of verified providers called the OAP Provider List to help you find a speech-language pathologist who can support you and your family. These SLPs are registered with the College of Audiologists and Speech-Language Pathologists of Ontario and have indicated that they have some experience working with autistic individuals. How do I maximize SLP services? To get the most out of speech and language services, it is important that autistic people and their families ask questions, self-advocate, and get involved. This will help ensure a positive and beneficial learning experience. For more information, resources, and services for the autism community, please visit autismontario.com.